Let's break down this combination medication, hydrocodone and chlorpheniramine. First, what is the brand name you'll most likely see this under? Brand name, Tussionex Pennkinetic. The Pennkinetic part is important. It refers to an extended release technology, meaning the effects of the medication will last longer. Now let's look at what's inside. This is a combination product, so it has two main components. Drug class. Hydrocodone. This is an opioid analgesic. While it's used for pain, it's also a very potent antitussive, which means it suppresses the cough reflex. Chlorpheniramine. This is a first-generation histamine H1 antagonist, which you know as an antihistamine. It works to dry up a runny nose, sneezing, and watery eyes. So when you put them together, what is the clinical use? Drug use. It's prescribed to relieve cough and symptoms of an upper respiratory infection, like the common cold. This is a critical point for safety and legal handling. Pay close attention here. DEA Schedule. Because of the hydrocodone, this is a Schedule II controlled substance. This indicates a high potential for abuse, which may lead to severe psychological or physical dependence. Prescribing and dispensing are strictly regulated. Let's talk about how it's administered and who should not take it. Dosage Forms S. It typically comes as an oral suspension or an extended-release capsule. Normal adult dose. For the suspension, a typical dose is 2.5 milliliters to 5 milliliters. Contraindications. This is a big one. It is contraindicated in anyone with a known hypersensitivity to either drug. Most importantly, it is contraindicated in all pediatric patients. This is a major safety warning. As with any medication, we need to be aware of potential adverse effects and warnings. Pregnancy warning. We must be very cautious with pregnant patients. Human data suggests there is a risk to the fetus. Common adverse reactions. You'll want to counsel your patients on these. They might experience CNS effects like agitation or anxiety, skin reactions like erythema, redness, or urticaria, hives, and GI issues like nausea and vomiting. Because of the two drug classes, you can also see chest tightness, wheezing, diaphoresis, sweating, and a dry throat. Remember, combining an opioid with an antihistamine can cause significant drowsiness and respiratory depression. Patient education is key.